So I'm going to start by asking Ade a few questions about sort of holistic approaches, but by all means, really want people to feel like they can join in and participate in this conversation. So please do. And please just raise your hand if you would like to get involved. But yeah, Ade, massive thank you for joining us today. I always think as a community of practice, it's fantastic to hear from people who are sort of have this very recent experience of doing this in practice. So I wanted to start by asking you, if it's all right, sort of what you think of when you think about holistic approaches to supporting people at a local level.
Okay. Hello, everyone. I think holistic approaches is something we've always all talked about, and it's always the aim of the type of work within the sort of employability sector that we've all tried to do, or we try to incorporate as much as possible into the way we support individuals. Some of the projects I've worked on in the past and some of the ones that I'm currently working on, including the No Wrong Door one with Black Thrive in Lambeth, are working across a range of different employability programs like Southwark Works, the Work in Health program, the Inspiring Families one, and even the work we do with the Refugees on the Rise program. Throughout those programs, the individuals will always present lots of different issues. So we're talking about language barriers, housing issues, debt, childcare, and so on and so forth. And it's, as you mentioned earlier, it's sometimes difficult to address those holistically. However, the way we work with these things is by developing a greater range of contacts of different either specialists within those areas. This works really well on the Southwark Works, for instance, where the different providers who support individuals with their employability needs, but the much wider needs that affect their employability prospects by focusing on particular areas. So one of the first things I would say about holistic approaches is having that understanding of who the other players are within that space and how they support your individuals, so you can make the right kind of referrals and work across that patch with the different partners in supporting those individuals in a sort of holistic way. Now, that's the sort of theory and that's the way we tend to work on it. But in practice, it can sometimes be a bit more difficult with maybe sometimes the lines of communication and so on and so forth. But overall, that's the way I would say we work holistically in supporting individuals within employability.
Thanks so much, Ade. And I'm really keen to hear a bit about your experience as well, sort of working on the recent No Wrong Door project, because I know we were trying to bring together lots of different aspects of a person's life in that kind of holistic approach. And I suppose I'm interested in kind of what you thought about, why that approach is a helpful one to take, or maybe actually why you think it's not a helpful one to take.
Yeah, I think first of all, again, it's something you alluded to, that we see the individuals as people first and foremost. So they're all going to come and present lots of different issues. Nobody is ever just one thing. So there's lots of different nuances to the different challenges that they all face. And I think the first skill of advisors or the person that they interact with is about how well they can build that rapport and build that trust, so people can actually explore or explain what their circumstances are. So I think first of all, it's always trying to understand the circumstances around that particular individual and how it affects them towards whatever goals or outcomes they want for themselves. Again, then it takes that sort of skill set to be able to look at those things, peel them apart, or pull them apart, see them for what they are individually, but also understanding how they all connect to each other to create this barrier for that individual. And then again, by talking with either people who are a bit more experts in those individual areas, coming up with that action plan or milestones plan, as it were. So in my work with the No Wrong Door project, that's largely the approach I take. So largely very informal to help people be at ease, try to really show that understanding of all the different circumstances that they may be facing, and trying to get a real understanding of how their circumstances affect them. And then try to explore what the possible routes are that might support them. So looking at those different interventions that may be available across Lambeth, for instance, where that project is based, and trying to link them and loop them in to each of the different partners that will best support them. So just a brief about what the No Wrong Door, how the No Wrong Door works is it's a collaboration of different partners that work within Lambeth, covering a range of different areas of disability, of race, or mental health. And the idea is they refer people into me who have run the gamut of their services, yet might still be a little way away from achieving those employability goals or employment goals for those participants. And my job is, through my employability expertise and experience, is to understand how those different issues that the individuals are facing could potentially affect them, and try to overcome those barriers for them and try to help them into work. And the collaborative works across itself. So one partner might refer someone in because they have addressed as much of their, or they've provided treatment for some of their health concerns. And then I look at, where did that intervention stop and what does it need to connect it to something else? And within that collaborative, look at the next potential partner who could potentially support them further. So it's a sort of a round table case conferencing where the right players are around the table, seeing that person for the range of all their different issues, and everyone pitching in the different solutions that can be run. And I collectively put that together in a nice, neat action plan or milestones plan for that person to be able to plot their path towards the goals that they want to achieve.
That's such a lovely way of framing it, Ade, because I think it is that sort of that while your responsibility is for that sort of employment bit, actually you're coming together with people whose primary responsibility is around that race equity piece or around sort of that person's health. And so it's really kind of, well, everybody's sort of got a different lens they're coming to it from. Actually, this sort of, it's not a single issue in the sense of none of those one issues has primacy, if that makes sense. Is that right?
Absolutely. I mean, the first thing for that collaborative is that we all take or feel this ownership of the issues, and we want to actually support the person. So we don't believe we have succeeded until we've collectively dealt with those collective issues, as opposed to dealing with them in silos. That's the aim of it. And we're trying to put that in practice by saying people are more than just their mental health, or they're more than just their housing issues and so on. It's about collectively taking responsibility for resolving those things and seeing how they connect to each other to overall achieve the main aim and outcome for that individual.
I really love that, because I feel like, thinking back to sort of the topic of conversation today, actually, sort of what you said around, you haven't achieved it if you just achieved sort of one part of it, I think really goes back to kind of looking at like a macro level, why it doesn't work to look at things so individually, because actually you haven't achieved it if you've just achieved a small part of it. I wanted to ask you about some of the barriers that you think there are to doing this kind of work. So sort of thinking about that approach in the No Wrong Door pilot that has looked at everybody coming around the table with a particular lens, but actually seeing that person as a whole. And what have been some of the barriers to doing that? Because it is a different way of working, isn't it? It is new.
Well, the barriers were many, which the good thing with the No Wrong Door work was, gladly, it was a pilot, so the whole idea was trying to see and explore a little bit more about the barriers in practice, because I think in theory holistic approaches make so much sense, and it just seems obvious that we should always be doing this. However, the practice presents its own different challenges. So I think we want to normalize it, definitely, but the reality is that different providers or different services have slightly different priorities occasionally. So looking in terms of circumstances rather than just the cohorts, as I said before, with the way it works in Suffolk, for instance, where you have those who might be focusing on those interacting with the criminal justice system, or those with housing issues, or those with debt issues, is looking at the circumstances rather than just seeing the cohorts. So if you're only thinking of your person as someone with health concerns, you might only focus on the health problem, as opposed to how that health affects them in another area of their life. So we try to design the service to treat the issues rather than just pigeonholing people into these different priority groups, as it were. And again, with the current systems, as I say, that favor these specialisms, I think one of the barriers is that when you focus only on the specialism, you lose a bit of coordination and collaboration with others for a holistic solution. So there's still it's still a bit disparate, so it's not joined up enough, and there's a lot of or a lack of clarity sometimes about the possible referral routes between different partners and how service providers can accommodate or complement each other. So that was initially a bit of a challenge. And then you've got the bureaucratic element in terms of things like data sharing and sharing clients, and who would the participant consider their main point of contact. And there's some of those things that had to be teased out, agreeing on what kind of documents or forms to be used. So initially when we're designing the program, we looked at all of those aspects. However, it was best to ensure that the participant or the individual doesn't feel like another number that's going through a project or anything like that. They have to feel that we are actively working with them as people, and we care deeply about their issues. And our whole aim is to collectively support them through that. So working with a slightly more informal approach to the participant or to the beneficiary of this support. However, behind the scenes, we are working in it in a way that's a little bit more formal and a little bit more formalized or structured. But having that understanding was a bit of a challenge initially, trying to get to that point. And again, as I say, just bringing the partners in to have that sort of shared responsibility and ensuring that everybody is in alignment with how holistic approaches should work and will work.
Thanks so much, Ade. We've actually had a question that I think really relates to something you just said around people get stuck in core specialisms. And I also think that, even people working in place-based or system change approaches, can very much do that, and that, we can get stuck in those kind of those specialisms or those issues, and it can be very hard to move outside of that. So I think calling that out is so important. And I suppose just thinking about kind of some of those sort of like structural barriers, those like entrenched barriers that might cause problems. One of the questions that Emily, who is a colleague from Place Matters, have asked is, how much does the scope and funding of different parts of the overall system impact on collaboration? So it'd be really great to get your thoughts on this, Ade, like thinking about how all of those different partners were funded and their kind of their scope in terms of what they were sort of setting out to do. How much do you think that impacted on the ability to collaborate?
Yes, that's definitely a very good point, because I think part of when we were forming this collaborative, and some of our discussions was largely around how we were going to fund some of these projects. So again, when I talk about structure and resources available to each of the different partners, a lot of it is always largely going to be based around the available funding to deliver on such a thing. So this being a pilot, it was quite a small pot. It was 50K, but however, we were looking at trying to raise up to about 200K or to access 200K for this kind of funding. So one of the things we wanted to do was to also ensure that the beneficiaries would have had representation and a voice within the project. So we were looking at developing a co-production group of service users with lived experience, but we didn't just want to bring them in and tap their brain for their information and their contributions to the project, rather give them something meaningful within it. So not only are they helping form that systems change, but they're also being remunerated for it in their time. But back to the partners, this is one of the struggles or one of the barriers in terms of whatever that available funding looks like. Everybody largely thinks in commercial terms initially, so they're looking at what slice of that pie they can achieve. So as I say, trying to renormalize this idea of holistic approaches and put in the person first with that human-centric approach, it means you're focusing less on what am I going to get out of this, and rather than or more so, what can I provide the individual? So largely what you think you find with the collaborative is that many of these partners are already delivering many of these services, and it's just sort of tagging this on to it as well and bringing that more into the fold and sort of trying to boost that. So I'm hoping I made sense there, or that's clear that you could follow that.
Yeah, absolutely. And I think it's a really helpful reminder as part of this conversation that actually when we're thinking about, those 12 missions that the government have set out in the Levelling Up White Paper around things like health or transport or education that are all like have very rigid funding structures. And actually, you were working around organizations with contracts or with similarly very rigid funding structures. And I think sometimes thinking about, maybe more at the charity sectors, it's easier to get funding and to do pilots and to do individual pieces of work. But when we're looking at an actual change to how we want to deliver sort of this kind of support across a whole local area, it really reminds you just how many barriers there are, as you say, because people are so entrenched in those kind of contract-based or kind of their own service delivery. So that's really, really helpful.